Okay, welcome everybody. Thank you so much for being here today and being patient with our technology issues. So I am Sarah Klutbane. I am the Boone County Hospital Foundation Director, and today we are hosting our monthly Educating and Empowering You program on heart health with the infamous Dr. Sarda. He's so kind to come back every year and give us updates and information that we need to know, whether you're maybe new to the cardiology world or if you're trying to do some preventative health. He is a wealth of knowledge, and I'm just really grateful that he's willing to spend some time with us today. So without further ado, I'm going to just turn it over to you, Dr. Sarda, to maybe introduce yourself to us and tell us a little bit about yourself and what you do for Iowa Heart.
I'm Rakshak Sarda. I've been working for Iowa Heart Center for 15 years. My primary responsibilities are in Ames office. I also do our cardiology education in terms of fellowship, residency, and student training in Des Moines, Mercy One Des Moines, where we have a cardiology fellowship program and internal medicine program. We also take students from DMU mainly to round with us. I also come to Boone as an outreach 2 to 3 times a month, depending upon how the schedule permits. I have multiple board certifications, which you can see it on our Iowa Heart Center website, and including vascular medicine, hypertension, internal medicine, cardiology, advanced heart failure and cardiac transplantation, echocardiography, cardiac CT, nuclear cardiology, and I may have been forgetting 1 or 2 more. So my main clinic practice is clinical cardiology and focus on preventive cardiology also.
Very good. Well, you are certainly very, very busy. And do you go Ames, Boone, Carroll? Where?
No, I go to Des Moines and Ottawa, Des Moines, Boone, and Ames right now.
Okay.
I used Iowa Falls in Marshalltown. Marshalltown office is closed. In Iowa Falls, we are unable to provide outreach services at this time.
Okay. Have you found that you've done more telehealth since the pandemic, or does that work for you at all with cardiology?
But telehealth is a very good service, and we would like to continue to do that if our patients can do that. And I am always trying to do telehealth whenever possible.
Okay, good, good. Well, we have just some Q&A today as far as just getting a little bit of, again, some background for people who may be looking at cardiology as a new thing, for example, in their world of if they're maneuvering some health issues. But maybe we can just start with kind of going through a little bit about the COVID repercussions. I know we talked about that last year as well. And just here we are a year later. Is there anything that you can update us on what you're seeing with regard to long COVID and the effect on the heart?
So, as you know, with the pandemic, a lot of people suffered COVID, and we see a lot of patients who have been still having some symptoms. We are not very sure if this is related to COVID or not, but we do an extensive evaluation for these patients because we have seen that the COVID had affected heart, COVID had increased risk of myocarditis, COVID had increased risk of pulmonary embolism. And those things can linger on, have long-term repercussions and all that. COVID time also we saw increased amount of heart attacks also. And as we all know, the services were down. A lot of people did not get their healthcare on time. So other aspect of COVID effects, and this would not be considered as long COVID, is people have to come to speed for their regular checkup, get the preventative health, let the other diseases, cardiac diseases, to be taken care of, because that is a thing which we are seeing. And there is a lot of pressure on the system as our patients have noticed that it's a long wait time, appointments are hard to find, etc. But they need to still continue to seek appointments, get their health, preventative health, etc. from cardiologists. standpoint also on a regular basis. Now, coming to long COVID, the symptoms are pretty vague. They may include fatigue, tiredness, shortness of breath, brain fog, palpitations, and these can be related to many other diseases. But when we are suspecting that there may be cardiac effects, then we do a complete evaluation. And complete evaluation, including a good physical exam, we do an ECG. We usually end up doing an echocardiogram for the above symptoms, and then see if there is any underlying condition which we can treat. Now, if you have cardiomyopathy, we treat cardiomyopathy. There is no specific treatment for COVID-related cardiomyopathy versus non-COVID-related cardiomyopathy, but it needs to be diagnosed. And then if we see that there is no structural heart disease, we could not find any other issues in terms of heart, then we have certain symptoms we treat and see how they go. It's a difficult situation for patients who are suffering from these symptoms. They need a lot of reassurance. They need a lot of cardiac rehab or exercise programs. And we'll come to that later during the talk, but these are the things which we are doing for COVID.
Do you, and maybe I'll put you on the spot a little bit, but I'm sure you've had a lot of people ask this over time in terms of long COVID and heart issues. Do you have a lot of people that kind of push back, for about lack of a better term, on that it is because of COVID and that maybe they had other comorbidities that might be causing them to have heart issues? Or how do you kind of identify that that might be an issue with their heart related directly to COVID?
So this will be the hardest thing to resolve. A lot of people think that because of COVID, they have these issues. And we would be unable to say, at least I cannot say what is what. So if that is the reason, you need a complete evaluation. So if you have blockages in the arteries of the heart and if you have weak heart, then you go and fix that. And now, cardiomyopathy is the biggest thing when we do not know why a person has a cardiomyopathy. And at that time, you have good treatments for cardiomyopathy and you treat them. Whether it is COVID or not, I cannot say for sure. So far, we do not have any diagnostic tool which can confirm that. People are working on it, and if we can get those things, then Iowa Heart is usually very cutting edge. And if it comes in, we will have those services.
Great, great. Thank you for that. I appreciate you addressing that. I guess just moving on to maybe talking a little bit more about the basics. You know, what are some of the warning signs that someone might need to see you as a cardiologist, and how would they get to see you?
So, you know, cardiology is a very wide field. We have a lot of subspecialists in subspecialties in cardiology, and there are multiple other multiple problems which can happen in cardiology. So, for common people, if we divide in broad categories, whether you have any blockages in the arteries of the heart, which is coronary artery disease, very prevalent, whether you have a weak heart, which can have multiple reasons for it, that is called cardiomyopathy. And then people can have valve problems, that is called valvular cardiology, where you have a problem with your mitral valve, tricuspid valve, aortic valve. Aortic valve is the most common. Or you have some electrical problems, like you have an arrhythmia, atrial fibrillation, ventricular tachycardia, SVT is called supraventricular tachycardia, simple palpitations, which is the common Can we put a pause on this thing for a minute?
Mm-hmm.
There is some emergency call coming in. Let's put a pause, okay?
Yep. Okay, so you were saying, we were talking about electrical AFib, and actually I had a question a little bit about that too, and just I think that we hear a lot about AFib, or maybe somebody's experiencing like what they would consider a heart palpitation. Do they need to go to their primary provider first and then get a referral to come see you? How does that process work?
So one thing which I tell my patients is, if you are not feeling well, in terms of if you're having chest pain, shortness of breath, dizziness, you have passed out, then go to the ER or get a very early evaluation from cardiology. The Again, you have to remember there are long wait times for everything right now. So you get into your primary care, then they send us the patient, and it may take a long time for that. So if it is a situation where you think you're not feeling well, um, go to the ER. Now, sometimes it can be a false alarm and all that, but we do not want to miss heart attacks. We do not want to miss pulmonary embolism. We do not want to miss serious arrhythmias because most of them are treatable and we can save lives.
Mm-hmm.
Now, regarding palpitations, you are doing well, but you feel that your heart is skipping a beat or it's beating hard. Otherwise, you're doing everything okay. You're going to your gym, you're going to your classes, you're going to do your work. Then maybe you can call your primary care physician. They can look into a few things, and or you can, if you're already established with us, you can quickly call us and we can get you an appointment. But anything, chest pain, shortness of breath, unexplained passing out, heart racing very fast, and simply I don't feel well, and you're unable to get to your primary care or cardiologist, go to the ER. A lot of people miss these signs and serious problems can happen.
Okay. And so are those the primary symptoms that people are looking for? Are there any unusual symptoms that people may not cue in as a heart issue, like back pain or that type of thing?
Very, very good question. So the biggest thing which we see is people stay home that they are having heartburn, they are having indigestion, and in fact, they may be having heart attacks, or they are having back pain and they say, oh, it's a muscle issue. But if the pain is not going away, if you have other associated symptoms, uh, and heartburn symptoms, if it is not going away, it's lasting for 20, 30 minutes, it's not explainable, seek help. We have seen too many missed heart attacks because of that. Heartburn is real coming from the heart, you know. So that kind of thing. And back pain, you brought it out. Sometimes people just simply come with a jaw pain or simple back pain or simple shortness of breath, and they are having a heart attack. I can't catch my breath is usually a symptom which we see with severe blockages or a heart attack kind of thing. If there is an unusual change in your activity, unusual change in your symptoms, like you are able to go half a mile without any trouble, and then you can go up a flight of stairs without having severe shortness of breath or some symptoms of chest pain, back pain, arm pain, extreme fatigue. This is not right. So you need to seek help. And sometimes there will be false alarms. There may be other things going on, but getting early for treatment for heart attacks or arrhythmias are very important. So people usually ask me, give me a list of symptoms. So we all know crushing chest pain and all those kind of things, but back pain, arm pain, jaw pain, shortness of breath, fatigue, simply not feeling well and terribly tired uh, can be presenting symptoms of heart attacks or heart related symptoms like atrial fibrillation, etc.
Thank you for that. Well,
And one more thing, Sarah, one more thing I usually tend to forget is women tend to have more atypical symptoms than men. So only 20%, 25% women will come with typical symptoms. Usually they are atypical symptoms. So women in audience has to be very careful about it. Now, sometimes we get too anxious about all these things. I understand that, but we have to be careful and seek help when appropriate.
Yeah.
And early.
Yes. Thank you for identifying that too. And I think that that is something that we want to make sure that people are aware of, that women might have a little bit different symptoms or a little bit atypical symptoms. So along those lines, you also mentioned, we talked about like racing heart that would go hand in hand with blood pressure. Can you talk to us a little bit about blood pressure and, strokes versus, heart issues and kind of how that all ties together?
So I think we can talk about what are the risk factors for overall heart diseases. So one thing, unless until you have congenital heart disease or something which is not very uncommon, if you take them out, most of the heart disease in uh, America, Western world, and now in fact in developing world is lifestyle. This is a lifestyle disease. So what are the risk factors? And then we can go back and see how we treat them. So risk factors for, say, coronary artery disease, which is blockage in the arteries of the heart or put you at a risk of heart attack, are high blood pressure, diabetes, smoking, sedentary lifestyle. A point which we do not consider too much is stress. Any inflammatory things which is going in your body. High cholesterol. So if you look into these things, these are predominantly for lifestyle. So if you obesity, so how we eat, how we exercise, smoking, again lifestyle. Diabetes is a lifestyle disease. Hypertension, most of the people have it, hypertension as they age. But if you look into the treatment for hypertension, lifestyle management becomes the key for hypertension treatment. So if you take everything, atrial fibrillation in elderly, it's lifestyle disease. Now in young people who have atrial fibrillation is a different mechanism, but if you are 65, 70 above, then it's a lifestyle disease. Sleep apnea, mainly associated with obesity. Some people may have sleep apnea who are not obese, but mainly associated with sleep obesity. So again, a lifestyle disease. So heart health equals lifestyle. Just if you have a good lifestyle where we have good dietary practices, and then there will be a lot of discussion about diets and what kind of diets. Then good blood pressure control, which has components of exercise, what you eat, and then the medications. Stress, again, lifestyle. So, and Sarah, you know that I put a lot of stress on stress management and non-pharmacological stress management, like meditation, like exercise. And there are multiple studies now proving that simple meditation decreases your risk tremendously. Simple meditation, simple 30 minutes of exercise, whatever way you do, whatever way. Now, one exercise may be better than this and all that, but do whatever exercise you do, whatever exercise you like, so that you can have a long-term exercise program, whether it's yoga, tai chi. Now, for elderly people, where we talk about base training like balance, agility, strength, tai chi is very good. Yoga is very good, and it doesn't mean that you have to have yoga asanas as masters do it. Even simple moving things can help, and if you have good balance, that helps long run, and it helps your heart health.
Mm-hmm. Yeah, and I think what's great too, that maybe was a good thing that came out of COVID was all the different resources we have available to us on YouTube channels and whatnot that we can follow along yoga practices or breathing practices and even qigong and tai chi that are very, very low. They're not going to be really intense for people, but it's just a slowing down and really getting people into their bodies, which I am a big fan of. But going back to even talking about the sleep apnea and breathing, I know you said you're a big fan of of having preventative practices in place, like the different movements and exercise and yoga and that type of thing. Talk to me just a little bit about breath work and breathing and how that kind of can also shift people's heart health.
So they did a lot of studies about how breathing can help. So as a regular breathing exercise and what we call a mindful breathing, they have seen that the heart rate variability decreases. Like resting breathing, they have seen the catecholamine response have decreased. Now they have these studies where they are coming up with this continuous glucose monitoring, and they see that there is less variation, less spikes and troughs with all those things. So there is something with regular breathing. exercises, whether it's pranayama, whether it's vipassana, whether it is simple our for whatever people have 478 or whatever the way they want to do it. Everybody has their own way, but do whatever, and it really helps. It helps your lung health, but somehow, if you concentrate on your breathing, and if your mind comes to the breathing, a lot of changes happen in the body. Now, people were talking about it 40, 50 years ago. In fact, if you look at this literature 2,000, 3,000 years ago, where they have talked about these breathing exercises improving health. But now we have scientific data, what it does to your brain activity. So people have done exercise, and mainly in California and UCSF, they have done these UC system. I don't know if UCSF, the UC system, University of California system, they have done these brain scans and other things. And simply by breathing and meditation, they have seen tremendous changes on these things. Also, a lot of our population is elderly, and we are having a lot of memory issues in our elderly population. And if you can do this thing, your memory also improves, and your dementia is pushed back, or maybe you don't get dementia or that severity. So I am a total fan of breathing. It does not cause any side effects. It's free, and you can do it whenever you want to. Just don't overbreathe. Breathe deep and breathe slow. Overbreathing will cause trouble. 10 to 12 times a minute is enough. Deep, slow, and also concentrate on your breathing. When you are doing breathing exercises, just think about only breathing. Your mind will clear up. I guarantee you.
Yeah, absolutely. Well, and I think that that is really great to point out some of these preventative type or even intervention type of practices that people can tap into. But there's also times where people need medication, that they need surgery, that they need, this extra level. Is there anything that's kind of happening in technology or medications or procedures in cardiology that are coming out that are new in the last year or newer?
Cardiology is that's why I say cardiology is the most fascinating field. We have new things coming out every month. Every new meeting, ACC meeting, AHA meeting, they are bringing in these new things, new studies, and are really changing people's lives. So, say about atrial fibrillation. We have new atrial fibrillation ablation techniques, and they are getting better and better. Now, in atrial fibrillation, as you know, that people are at a risk of stroke. So we give them blood thinners, and then they have bleeding problems with the blood thinners. And Iowa Heart Center is the robust program for what we call left atrial appendage occlusion. With now they have 2-3 devices on that, or 2-3 procedures on that, and they have a robust program on that. And that is very new. We have, I think now nearly 10 years of experience on aortic valve replacement without surgery. They do it through the groin or through some other exercises, but they don't have to do an open heart surgery. And they have, I think, done more than 1,000 patients, if I recall right. So when I started my cardiology career, every time there was aortic valve stenosis, we had to do open heart operations. And now, most of the patients who are at a high risk or moderate risk, they just simply get the valve, and they do really well. In terms of medications, we are getting some newer medications, and one is for cholesterol. For last 3-4 years, we have gotten these medication injectable, which really brings the numbers down on people who are unable to tolerate the cholesterol medication. There are new medications on pipeline. They are using these technologies which we learned in COVID for cholesterol treatment. One injection in 6 months, you don't have to do anything. Those kind of things. Really fascinating, really fascinating. People were on Coumadin all the time and had difficulties. Now we give them these newer medication, although they are very expensive, but then the other problems are less with those medications. And there are newer studies about diabetes medications in the heart health, which are in forefront. And mainly the time is spent and money is spent on newer procedures, safer stents, safer ablation procedures, etc. Cardiac surgery is also doing very well. They have now hybrid procedures for atrial fibrillation, ablation, etc. So the list keeps on going. So talk to your cardiologist for any of these procedures which you think may benefit you.
Yeah.
Excuse me.
Yeah. Well, and along those lines, when you talk about cholesterol, I mean, that's something that can be lifestyle, but also is there a genetic component on that as well?
Yes. So one thing which I would want our audience to look into is a concept called epigenetics. So we'll not go into the epigenetics, but look into the concept of epigenetics and what genetics mean and how environmental factors work and how other things bring out a disease which you have genetic predisposition, etc. Yes, a lot of people have the genetic predispositions which put them at a risk. And cholesterol, a lot of people have familial hypercholesterolemia, familial hypertriglyceridemia, which runs in families. And good news is we have some treatments in this regard. Sarah, you have to hold again. My patient there on the table has an issue, okay? Specialties, and we work in collaboration with each other. So my interventional cardiology colleague just came in and told me about the results of the test she did on my patient, which I was working earlier, uh, and uh, and then we made a plan. And in Iowa, it is very good. So even if we are in Ames and we don't have CT surgery services here, in Iowa Heart Center, we'll just send the patient to Mercy One in Des Moines, where we have heart surgeons and high-risk intervention procedures, which we cannot do here. So again, very collaborative. So talk to your doctor about second opinions at a subspecialty consultation for any. We usually do it on our own, but you can always ask for them.
Yeah, that's great. And cardiology interventionalist, she's fairly new to McFarland, is that, or Mary Greeley, is that
Yeah,
correct?
yes. But she is very good physician.
Yeah, yeah. I mean, as a service, that's a fairly new service, or was that something that people had to go to Des Moines before?
No, we have interventional cardiology here in Ames. We don't have surgery services here, but there are certain high-risk procedures where they may need a surgical backup. We don't do it here. We send them to Des Moines. Okay. We have Dr. Bhatt and Dr. Kumar here, who are our other interventional cardiologists. We have Dr. Sorrentino, who is our electrophysiologist, and we have two doctors, Dr. Pete and Dr. Fagowski, coming in to fill in for any gaps from Carroll and from Des Moines and Ames. Dr. Fagowski is from Carroll.
Okay.
And we have those facilities. But we are different groups, Merrigley or McFarland Cardiology and Iowa Heart Center are different groups, but we work in collaboration. We share our calls, so that means we share patients, and then we share each other's, whosoever can have a specialty. Like I do angiograms, and if Dr. Vijay Kumar is not available, nobody is here, then I do the angiograms for the whole hospital.
Okay.
And Dr. Christensen will do the pacemakers for the whole hospital if nobody else is available. Very collaborative.
That's wonderful.
This is very good, Sarah. Like it helps patient, it helps us, it increases our longevity in cardiology, because as you know very well that medicine is very stressful, and physicians have a very stressful life. And if we can help each other, and if we can help our patients, and if our patients can help us, the outcomes are better. The outcomes are always better. Keep calm. I always say it will be fine. Keep calm, and the outcomes are always better in that situation.
Thank you for that. Thank you so much, and it's good to hear. I'm sorry, what?
That was a side note.
Yes, well, it's very good to hear about the collaboration, and like you said, I mean, you want to keep your stress at a minimum also, so that you can, be helpful to your patients as well. So on that note too, we just have maybe a few minutes left of your time. I mean, gosh, we are so grateful to have a little bit of time with you today, because we know you are so busy. So thank you for that. I know you're here at the Boone County Hospital Specialty Clinic at least once or twice a month, I think now.
I think it comes to twice a month.
Yeah.
We may increase our services a little bit there, depending upon, as you know, everybody is very thinly distributed. It's very hard to recruit, and it's very hard to support cardiologists. So it's not that easy. And I can see patients' frustration, but this is the situation we are working with. One thing through your program, I would also like to thank all our ancillary staff, whether even you for the foundation, you know, you're putting out these programs, our nurses, our front staff, our transporters, our dietary aides, you know, everybody, our sonographers, CT technicians, ECG technicians, everybody had worked very hard during these COVID times. They put their lives on risk. They put their families' lives on risk. They had put in long hours. And a lot of people have fatigue. A lot of people people need support. And this is the time we need to thank everybody. Thank everybody, because this has been tremendous 2-3 years in this COVID. And we all know, the patients also know, they also went through a lot of losses, a lot of issues. We should all work together. We should all work in a calm manner. And the better our interpersonal relationship would be, the better the outcomes would be. You fight with any of the staff, any of the doctors, any of this thing, the outcomes are not good. They are never good. So we have a extreme shortage of staff everywhere in America. It's not Iowa. Everywhere we have extreme shortage of staff. And a lot of our nurses have quit. So we have a lot of shortages of nurses. A lot of doctors have retired. So we have a lot of shortage of doctors after this pandemic. So let's all work together, and let's all work for good, at least from cardiologist standpoint, heart health in Iowa, and work on your mind and body. Mind-body medicine, as they call it. A lot of diseases start with the mind. Do spend time for meditation, whatever technique you like. And it will be hard. It's not easy. Meditation is one of the hardest things you will do. But slowly, you will get to it. And even if you can make 10, 20, 30% changes, it will help. One thing which I would like to talk to you, Sarah, before we go, is you are what you eat. So look into your diet. Diet is most important part which you can change for yourself, for your families, for your friends. Go for fresh vegetables and fruits. Move towards plant-based diet. And listen to some good lectures on diet. There are a lot of YouTube lectures on diet and heart health. Listen to them and follow them. It really helps. And Sarah, you personally do it, so I know that you have experienced these things.
Yeah, it's great. Truly, I mean, YouTube and all the different outlets that we have to give us some of these resources is so helpful that people can look up, and maybe at some point in time I can get a couple from you and we can send them out to you know, our patients or people listening and that type of thing. And I want to go back really quick too before I let you go. Just you talked about two different things that I think are really interesting to note. And one was you talked about compassion fatigue, I think is the term that we're talking about when you talk about the front line and people being, you know, really spending a lot of time caring for all of the patients. And then also we have all these staff shortages. And again, compassion fatigue can play into some of that stress and heart health. So again, you know, people who are in healthcare, we're really hoping that they will hear you and your message as well, as far as, you know, diet and exercise and breathing and meditation. And those are some of the tools that people can implement just a few minutes a day doing and can make big strides.
And taking your medications on time and regularly.
There you go.
People do skip their medications, and that's not good.
Yes, and medications and seeing your heart doctor. The other thing I wanted to just quick mention that you talked about, and I think this is something that's really coming out this year in kind of this world of interpersonal relationships. When you talked about that, the Harvard study, I recently was watching the video on that they've done that Harvard study for, I think it's been like 85 years now or something and going. There's been obviously a number of administrators overseeing it, but their question was they watched two different groups of people, of men, over their lifetime, and what made them happy. And what the answer has been all relationships. It hasn't been how much money they made. It hasn't been their career or anything, but just again, I think you're emphasizing that importance of interpersonal relationships and having a support system around you, even if it's one or two people that are really, special to whoever it is, to them. So I just like to make that plug that's a really interesting study to look up as well.
Thank you, Sarah, for sharing that. I'll look into it, but I know it. Even if they do study or not, there are a lot of ways we can look into life in a positive way. We don't have to look life in a negative way. Whatever the situation is, including death, illness, we can look into life in a positive way, and that helps your heart health, your brain health, risk of dementia, risk of heart attacks, risk of arrhythmias, longevity, simple aches, pains, your stamina. So just thinking everything in a positive way. Even the worst of the situation, learn how to make things positive. It may be 10%, 20%, it may not be full, but you will realize the power of it. I have personally seen it in my life. It really, really helps. And the family, friends, neighbors, community becomes very important for a good health and a healthy outcome.
Yeah.
I absolutely agree with what you said, Sarah.
Thank you. Thank you so much for, again, bringing your wisdom and knowledge to our program here today, and just having the opportunity to converse about everything from the preventative side to some intervention, and when to call your doctor or when to go to the ER, and that all of it is just really helpful for anybody listening that is again maybe kind of newer to this world, in terms of maybe they just recently had a diagnosis, or somebody who's just wanting to maintain their health and longevity. So thank you so much for your time. We're so grateful. Was there anything else you wanted to add before we sign off?
I thank you for the opportunity. And one thing I will tell you, there are a lot of smart people working on it. Very, very extremely smart. And I spend a lot of time on YouTube listening to these people. Please find good articles, please find good lectures, and very, very smart people. It's mind-blowing smartness is available on YouTube. And you will get a lot of information. And I hope everybody does well. And I wish everybody good health and happiness.
Thank you so much. We'll see you soon, Dr. Sarda. Take care. Thank you.
Thank you.
Bye-bye.